So after March 17th, once the exam is over, if you still feel like continuing the traumatic experience, because my elder son is taking his 10th exam, 10th class exam. After the maths paper was over, in our days we used to be enthusiastic how we answered. He said, why already paper is over, no? Enough of drama is over. Once more sitting, what mistakes we did, crying about it, why dad? So life is much bigger and more beautiful than the stupid trigonometry and geometry. So if you feel like that, don't come. But if you still feel that, chalo, let us see logistically what were the questions, how was it, we will have afternoon of 17th after the exam to sit and write the paper, and on 18th we will have a discussion on the paper. March 17th only, no exam, no more surprises, right? Good. So Wegener, this is a little challenging question, not at the undergraduate level. Kidney tissue versus lung tissue. Why vasculitis in Wegener involves upper respiratory, lower respiratory and kidney. Which is much more diagnostic in its yield between the three. From sinus lete biopsy या lung से लेते या kidney से लेते. You can take from any of the three. But lung biopsy offers more dependable sample for diagnosing that necrotizing vasculitis of the Wegener rather than the kidney. You can't depend on kidney to diagnose, but you can depend on lung to diagnose the vasculitis of Wegener. Okay. Any other answer you thought? A. Male to female ratio is 1:1. Oh. Probably the first case you might have seen would have been female. I still remember the first case I have seen of Wegener was one medical student, he was a house surgeon in Usmania, his mother with cavitating lung lesion. And you know what treatment we started on her? We started her on antitubercular therapy. Antitubercular therapy, because there was a cavity. Her MANTO was positive. Being born in India, anybody's MANTO can be positive. And cavity with a MANTO positivity with a hemoptysis as a presentation means it can only be TB in our country. So we consoled him that don't worry, she will be alright. And as a postgraduate, first year postgraduate, I still remember. So that day night duty, she had another bout of hemoptysis. Chest radiograph was flooded with pulmonary, what you call, alveolar edema. He came with the CMDT, sir, in the morning rounds you thought it as TB, started treatment to my mother, everything is good. Somehow in my innermost corner there is a feeling that it can be Wegener. It can be Wegener because I was reading CMDT sitting on her side and she had another bout and X-ray showing deterioration. Then we sent the ANCA. Turned out to be positive. Then did the renal assessment. Concluded. Started on immediately on the cyclophosphamide. So that's how the diagnosis will come if you have that index of suspicion. How will that index of suspicion comes? Either if your treatment patient is not responding, then what you need to do, you need to pack your ego onto the side and rethink about possible reason. Alright? So that's the whole idea. So male-female ratio means my first patient was female. Of course, we have seen a lot of males also. Now, Creutzfeldt-Jakob, it doesn't occur in India. Why? There are many other reasons to die in this country other than getting Creutzfeldt-Jakob's disease. So, sporadic versus familial, if you take doctor, 20% of the total number of CJD are familial. So, sporadic is more common than familial, not less common. All the remaining are true. Mulberry-like turbinates are typical of very standard question. vasomotor rhinitis, right? Then temporal bone fracture, another traditional question in APPG question bank. Longitudinal fracture, you need to break the head and decide in the exam hall. If you don't know, what is your answer? Longitudinal. Tower-like skull, where do you see? This is called tower-like skull, classical. Apert syndrome. You ask your classmates to remember this, you don't remember, not worth it. Cotton-Myers classification, another standard old question. What is the answer? Reflex level में subglottic stenosis. Perichondritis, if it occurs commonly due to diabetes and pseudomonas infection, it is much more common. Anthem of Highmore is the name given to maxillary sinus. Very good. It is a pyramid shaped maxillary sinus which is the largest of all the paranasal sinus, which have the name called anthem of Highmore. Homan-Miller sign, what is the meaning of it? Before you agree with the answer of angiofibroma. Beautiful. It is the anterior bowing of the posterior wall of the antrum on a lateral skull film, which is typically seen in the highly vascular juvenile nasopharyngeal angiofibroma, which only occur in boys or also girls. Only it's a curse for the boys, not for the girls. Now, otostenosis, what is your answer? Huh? See, what is the meaning of Schwartz sign? Very good. So, the redness of the promontory of the tympanic membrane which you see is a useless sign in ENT because it is not reliable, it can't be relied on. Then why will you take a decision whether to operate or not based on that? You have other reasons to decide operation. Nasopharyngeal, anybody other than cervical lymphadenopathy, novel answer. Everybody thought cervical lymphadenopathy. Sure? Hoarseness? No, hoarseness is not there. Hearing loss or epistaxis? No. Very good. Very traditional question. This is another very difficult. See doctor, these are all the questions which you can carry by cutting papers and carrying in the pocket. Because after exam is over, I am telling you, within 1 week if I ask you, you won't remember. Not after exam, after getting result. After getting result, you won't remember. But still they are used to grade, stratify people, divide people, elevate some, depress some. I don't know what is the purpose. Entrances should change in their style. So anyway, what is BERA? Wave 1, 2, 3, 4, 5. So we need to remember cochlear nerve is 1 and 2. Cochlear nucleus is 3. Superior olivary complex is 4. Lateral lemniscus is 5. Inferior colliculus is 6 and 7. At least for this purpose you can remember 3 things, common questions. Superior olivary complex is associated with audition. What is inferior olivary complex doing? Where is it located? It is typically in the medulla. It is the one which is trying to bring relationship between who and who? Spinal cord below, brainstem above, cerebellum on the side. So inferior olivary complex is used in coordinating the 3. It is not related to audition. It is superior olivary complex which is related. Lateral lemniscus is associated with audition. What is medial lemniscus doing? It is carrying dorsal column, proprioception, everything is medial lemniscus. Inferior colliculus, intadi. Superior colliculus, sustadi. What does it do? Vision is superior colliculus. Inferior colliculus is audition. Then you have geniculate bodies, medial and lateral. Medial क्या करेगा? Medial will be looking to ear which is lateral. Lateral geniculate body will be looking medial to the eye, which is a medial structure compared to ears. So that's a story. So common question asked in the exam. Now optokinetic nystagmus. Tomorrow when you join MD General Medicine, when you go to neurology posting, what will you not forget to carry in your apron pocket or knee hammer? Why? Why? Because your neurology professor will get a heart attack for small things, you know. I still remember our neurology professor, splitting headache. You don't carry ophthalmoscope also and come to neurology rounds he used to have. So not for patient's sake, for our professor's sake, because we are worried that such a wonderful professor may die because of a stroke, because a fellow like me not carrying ophthalmoscope. How can it happen? And we used to carry. So you need to carry one ribbon. What is the purpose of a ribbon in a neurology posting? You need to run the ribbon and then elicit the nystagmus, optokinetic nystagmus, right? So there are few gadgets which you need to carry like a tailor or a carpenter going to work while you are a resident. While you are a consultant, you won't carry anything. You will carry your resident in your armpit, because he will collect all radiological reports, everything, and finally you will say, okay, this can be possibly grade 3 brain tumor, neurosurgeon ko bhijao. This, we doubt whether it is an abscess or edema, but anyway, retain him in the ward. This can be stroke in the early stage, I am not sure, get a FLAIR MRI image. So, armchair management you can do as a consultant, but as a resident you need to sweat and carry all these gadgets, without which professor will not be happy to pass you. So, brainstem, okay, there is a horizontal nystagmus, there is a vertical nystagmus, doctor, in the optokinetic nystagmus. So, asymmetric horizontal nystagmus means problem in the optic chiasma. Asymmetrical vertical nystagmus means problem with the brainstem. Simple thing to remember. Don't think more about it. You can anyway think after joining MD. Now, cavernous sinus may, which nerve is not involved? What is your answer? Is fifth is involved? What was your answer? What do you have in cavernous sinus involvement, doctor? Visual loss, proptosis, ocular conjunctival congestion, elevated ocular pressure, ophthalmoplegia and pain. So these are all the features involved. You doubt about the corneal blink reflex as the answer. V1. V1 is ophthalmic division. Ophthalmic division is there in the cornea. I was doubting option B. We will check that.